Thank you guys so much for being here today. 1 year ago tonight, Oklahoma City was in the national spotlight. We canceled the Thunder game just minutes before tip-off because a player from Utah had just tested positive with the new coronavirus. When that happened, there were just 2 known cases in the state of Oklahoma. Since that time, we have faced challenges we never thought or never predicted a year ago. We felt the impacts of the pandemic on every part of our lives. Many started working from home. We saw our schools close. The 3 W's, wear a mask, watch your distance, became part of wear a mask, wash your hands, and watch your distance, became a part of our everyday life. Hand sanitizer became an essential part of our lives, like our car keys and our wallets. For most of us, this has been the longest year of our life, but we've weathered the storm together. We've mourned the loss of family members, friends, and neighbors to COVID-19. And our hearts continue to go out to those families and their loved ones. 1 year later, we're coming to an end of the COVID-19 pandemic. The worst is behind us, and the light at the end of the tunnel is brighter than ever before. Oklahoma, we are on track to get our summer back. The fact is, our state navigated this pandemic better than most other states. For the past year, I've told Oklahomans that I would make the right decisions at the right time for our state. Our goals have always been to protect the health and lives of Oklahomans, to mitigate the impacts to our economy, and to get our kids safely back in school. Every decision we made was on time and on target with federal guidelines. We were one of the first states to shut down visitors to nursing homes, prisons, veteran centers. That decision saved countless lives. We turned over every rock so we could deliver PPE to our frontline workers, our first responders, and our teachers to keep them safe. We expanded free COVID testing to all 77 counties. And we made sure that anyone who wanted a test could get one. In fact, in a state of 4 million people, we have now tested over 3.5 million tests. We cut red tape to ensure that 350,000 Oklahomans could receive benefits, unemployment benefits. We efficiently and transparently administered $1 billion in COVID relief funds. We replenished food banks. We halted evictions. And we delivered small businesses the relief that they needed. We spent $250 million to cities and counties to support Oklahomans in every corner of our state. Through the Oklahoma Business Relief Program, we invested 8,661 small businesses. That covered 344 communities in all 77 counties. And that protected hundreds of thousands of jobs in Oklahoma. We were the first state to fully reopen on June 1st of last year, which put 100,000 more Oklahomans to work. Now, we have the lowest unemployment in the region, and we have a budget surplus of $1.6 billion. That means we don't have to cut core services like so many other states are having to face. In fact, New York has a $10.2 billion budget deficit. Governor Cuomo just said this week that he wants to raise taxes on his citizens. I listened to parents and demanded that we put students first, and we pushed hard to reopen schools. We prioritized teachers in our vaccine rollout. We made sure that every single school had the PPE that they needed. And we gave grants to schools to cover COVID-related expenses. Today, most of our teachers have had at least one vaccine. Our kids are back in the classroom. All residents and staff in nursing homes and long-term care facilities have had an option for a vaccine. That means our most vulnerable population is now protected. Oklahoma has consistently ranked in the top 10 at administering vaccines. We're actually ranked number 7 in the nation. Over 1 million vaccines have been administered, and over 400,000 Oklahomans are fully vaccinated. This week, we moved into phase 3 of our vaccine rollout. That means 2 million more Oklahomans are now eligible. We are getting doses in arms as soon as they come into the state. 170,000 more doses are on their way this week and will continue to be relentless. When you take a step back and look at everything that we've done, it is clear that Oklahoma took the right approach. I'm so proud of our team, so proud of Oklahomans for coming together and doing their part. You did a fantastic job, Oklahoma. Now I want to turn it over to Commissioner Frye, Dr. Frye, to talk about the months ahead and what our goals are for this summer. Dr. Frye?
Thank you, Governor Stitt. It's hard to believe that 1 year ago, we stood here first talking about COVID-19 with so many unknowns and questions about where we were headed. It feels like a lifetime ago, but at the same time feels like yesterday. We've seen unimaginable challenges this year that have stretched our public health infrastructure and people more than we could have ever predicted. At the onset of the pandemic, early projections were that we would have approximately 33,000 Oklahoma deaths and more than 200,000 hospitalizations and over 2 million cases in the state of Oklahoma by July 1st, 2020. We faced challenges such as insufficient supplies for PPE and testing and antiquated equipment at our state's public health lab. At the beginning of the pandemic, we couldn't test more than 100 specimens a day, and now our public health lab can test up to 30,000. Additionally, we had to map out how to effectively communicate with Oklahomans about a wholly unprecedented situation. Our state was facing a public health crisis of an unprecedented scale last March. But I'm proud to say that we are not only have we built a robust pandemic response over the last year, but also positioned Oklahoma to successfully face any future challenges. But while these challenges have been hard, there have also been many opportunities throughout this pandemic that I'd like to highlight today. We all mourn those Oklahomans who are no longer with us as a result of the virus. Every one of their deaths weighs on me and everyone in this room. I won't stand up here today and say every decision we made was perfect, but I can promise you that we put the health and well-being of Oklahomans first. And for that, I'm incredibly proud. Like every other state and nation, our battle with COVID-19 has ebbed and flowed over the past year. Today, COVID-19 counts are at the lowest level since last summer. In February alone, our 7-day case average decreased from around 2,200 to around 800, and now it's 615. We have seen cases dramatically fall for every age group, but especially among our 65 and older population. We prioritized our most vulnerable populations, and I'm proud to see these numbers continue to decline. Our response greatly reduced the impact of COVID-19 compared to the initial projections, with total cases 78% lower than originally estimated, and hospitalizations have decreased over 80% since they peaked, which I believe was in January. Overall, hospitalizations are in line with what we saw last October, and every region is now in the green or Tier 1 phase of our hospital surge plan. At the outset of the pandemic, we assumed many more Oklahomans would die and be hospitalized due to COVID-19. I don't say this to diminish the Oklahomans' lives that we've lost. We know families have been shattered by this virus. But we have reasons to be hopeful about the months ahead. The bottom line is we're on the right track. Thanks to our aggressive vaccination efforts and growing natural immunity, COVID-19 will continue to recede even further over the coming months. Let me be clear, the virus will never completely disappear. We're learning to live with the virus, and we have to embrace our new normal. The goal was never 0 cases. The goal was always to prevent serious illness and death from COVID-19. And this goal is achievable, and we need your help encouraging everyone to get vaccinated. The light at the end of the tunnel is getting brighter. I want to assure you we're going to keep fighting. Our successful vaccine rollout will only speed up as supply increases. This week, we moved to phase 3 out of our plan, as the governor said, which opened up another 2 million Oklahomans to be eligible for vaccine. I urge every Oklahoman to get vaccinated as soon as possible. As of today, we've vaccinated 1,334,818 total doses administered, with over 700,000 Oklahomans receiving their first dose and over 400,000 Oklahomans receiving both doses. 57% of Oklahomans 65 and older have received the vaccine through the Department of Health. That doesn't include what was also given through IHS and our tribal partners. When you include those, our estimates are going to be closer to around 67%. We are on the way to herd immunity as a state. We are scheduled to receive 170,000 vaccine doses this week, and that does not include the single-shot Johnson & Johnson. Also remember that vaccine only requires 1 shot and doesn't require ultra-cold storage like the Pfizer or the cold storage like Moderna. This means it will open up opportunities for us to distribute the vaccine all across the state. I'm proud of what we've done so far, and we're optimistic as we continue to make progress through the plan. Continuing precautions is vital in the meantime. We want you to keep up the hard work and collaboration that Oklahomans are so good at by continuing to follow the 3 W's. Wear a mask, wash your hands, watch your distance, and add the 4th one, which is wait for the vaccine. Use your best judgment to protect yourselves and one another from COVID-19. We encourage you to get the vaccine, and let me be clear, the vaccine is very safe and very effective. It prevents you from getting seriously ill or dying from COVID-19. And that's a key part of helping us get back to normal. As we project forward with what our new normal is going to be, I can say we're transitioning into that now. As our cases come down throughout the state and our vaccinations go up, we're approaching what we're all going to have to move forward with. And we are working with our state partners at this time to help give good guidance on what that's going to look like in the future. I want to end by saying that I'm so impressed with the Oklahomans throughout this pandemic. The Oklahoma Standard has been on full display, and I know we're all anxiously awaiting for the day when we can fully reconnect with friends, loved ones, and coworkers, and I can't wait. We're going to have an very aggressive vaccination plan up to the summer to try to get our summer back. I also want to thank all the public and healthcare workers who have been on the front lines over the past year. We know how difficult it has been for you, and I want you to know how much we all deeply appreciate your efforts. I'm going to turn it over now to Secretary Corbett to speak on how we're learning from COVID-19 to keep improving our public health infrastructure in Oklahoma.
Thank you, Dr. Frye. Throughout the past year, we face huge sets of unknowns, challenges, and continually changing circumstances. And we've been improving our public health response as we learn more and more about COVID-19. There's, of course, a lot still to be done in the fight against COVID-19, but it's also not too early to think about our next pandemic possibility and to plan for that, and also to plan for continued health improvements in our state. This past year, we were able to formally announce the opening of the Oklahoma Pandemic Center for Innovation and Excellence, the first of its kind in the nation, thanks to Governor Stitt, to Dr. Frye, to Secretary Pollard, Secretary Arthur, Dr. Casey Schrum, and so many others. Their vision and countless hours made this dream a reality. And we're already seeing the benefits of the new state-of-the-art public health lab. In a short period of time, Oklahoma has significantly increased its testing capability and is now able to analyze samples of the COVID virus to detect variants and different strains that may be present in the DNA, which is so vitally necessary, often called sequencing. Our testing capacity, as Dr. Frye mentioned at the lab, has gone from 100 tests per day at the start of the pandemic to nearly 30,000 today. Our goal is to sequence 10% of the positive COVID samples we receive in the state. Previously, we only had the ability to sequence less than 0.1% of the positive samples in the state. This increased focus on testing and sequencing will improve our current response to COVID-19 and help us plan for future pandemics as well. With these expanded capabilities, we'll be able to identify the new strains of COVID-19, which is vitally necessary to fight this pandemic. In the long term, however, we are building a repository of samples that will inform our future public health needs and our response, with a focus on One Health, which is human, animal, and environmental. And Oklahomans will benefit from this new public health lab for many years to come. What we've learned over the past year will also drive our future health responses moving forward. Oklahoma currently ranks 46 nationally in public health. This is unacceptable, and this cannot continue to be our norm. And we have a real opportunity to take the lessons we've learned from COVID-19 as a leverage point to show we are capable of so much more from an innovative standpoint. How we've responded to this pandemic should give us confidence to push towards a greater innovation in improving health outcomes in the state of Oklahoma. I'm optimistic about the work we've been doing at the Pandemic Center, at the Public Health Lab, and the medical centers around the state by public health innovators and leaders who are not only studying the health issues that we face in Oklahoma, but taking actions to improve those. I'll now turn it back to Governor Stitt.
Thank you so much, Mr. Corbett, Secretary Corbett. I also want to give a shout out to Jimmy, who has done a fantastic job this entire time with the sign language. I'm wondering if he's signing thank you to himself right now. So really, he's done a great job. You know, I want to reiterate what Dr. Frye said earlier. This virus will never disappear completely. It's going to be in Oklahoma for a while, but we can get back to normal. We have a plan in place to make sure you can safely go back to work, your kids can safely go to school, and you can get a vaccine. Because of the progress we've made, I'll be issuing a new executive order tomorrow. There will be no statewide restrictions on events or Oklahomans. I'm also removing the requirements to wear a mask in state buildings. More Oklahomans are getting vaccines each day, and the CDC's new guidelines mean wearing a mask should be a personal decision based on your circumstances. But let me be clear, COVID is still here, still in Oklahoma, it's still in the United States, and we still need to do our part. You can still, and you're even encouraged to wear a mask depending on your circumstances. And I've said from the very beginning, the standard for normal cannot be 0 cases. In Oklahoma, the standard for normal is freedom. The freedom to worship, the freedom to go to work and earn a paycheck, the freedom to visit your loved ones in nursing homes, the freedom to send your kids to school in person, and the freedom to protect your family however you see fit. As long as I'm governor, I will protect the freedoms of Oklahomans. I'm happy to open it up to a few questions to myself or the panelists.
I wanted to ask if you could go back a year ago. You obviously had you had a lot of people pushing for more restrictions. You had a lot of people pushing to reopen the economy. Can you just kind of talk me through that decision and how difficult it was for you? It sounds like you clearly don't have any regrets.
You know, I'm really proud of the team and these decisions. You've got to remember, we have been in COVID updates. John Budd and I were talking about that 7 days a week on the early on for the first couple months in person as we were gathering all the information. But I'm really proud. I told Oklahomans from the beginning we would always make decisions based on the facts in our state, not what we were seeing on television. And early on, there was a lot of things going on in other states, but I believe that our team made the right decisions for Oklahomans. And it was never about magic words. It's always about personal responsibility, doing the right things. That's what I've always encouraged Oklahomans to do. And I believe we stand by our decisions, and we've done a really, and I just want to thank Oklahomans for innovative and doing the right thing, and they've done a really good job. Businesses have innovated. And I want to give a shout out to our healthcare workers. Those folks on the front lines have done a tremendous job as well, as I've toured hospitals around the state. But yeah, there's obviously pushing from one way or the other, and I had a great team around me, and we made the right decisions based on the advice of our health professionals, and we had a great strategy. We balanced the health of Oklahomans with mitigating the effects to our economy, and also the health of our kids and getting them back safely in school.
Now the right time to drop restrictions? I know the CDC has encouraged states to wait just a little bit longer before doing that. Why do you think now is the right time?
Well, based on, you got to remember, Oklahoma has been fully reopened since last June. We're watching these cases. You just saw the graphs. The numbers are lower today than they were last summer on a 7-day average before some of the municipalities put in more of the restrictions. So we look at hospitalizations very closely. That was the whole goal when we thought about, flattening the curve. Remember the 15 days to flatten the curve last spring. And it was really to make sure that we didn't outpace our hospital capacity. Now we had less than 300 people in the hospital statewide, and we want to get our summers back. We want to start doing the things to get our summers back, but also at the same time, we're telling Oklahomans personal responsibility to continue to be vigilant, and I think Oklahomans will do the right thing.
Governor, what role did the Oklahoma City and Tulsa City County Health Departments play over the past year, and would the COVID response have been better if they were under the state health commission?
I'll give you my thoughts, and I'd like to get Dr. Frye's thoughts. So Dr. Frye, this is something Oklahomans need to understand. So the state health department covers 77 counties, and then you have some Oklahoma County, Tulsa County have a separate system. Early on, we signed an executive order that brought all that underneath the State Department of Health, and we could have more of a collaborative messaging going out. Once I lifted that restriction, it went back to kind of two separate county folks. They I'm sure did the best that they could do, but there was certainly there wasn't a coordinated approach when you had two health departments kind of doing their own thing. But we continued to move forward with our strategy and what we were recommended from Dr. Frye, and I'm sure those guys did the best they could. You have a comment on that, Dr. Frye?
Yeah, I mean, we all work together. We were in, very close communication. But, anytime you're in a response or a situation like that, when you have differing chains of command, it really just makes the situation more difficult. But, either way, moving forward, we're going to continue to partner with them. It's all about just collaborating, working together as a team to improve the public health infrastructure of the state of Oklahoma, and that's really what we're going to do no matter what.
Governor, can I ask you about the latest stimulus package? Oklahoma's got quite a millions of dollars coming. Do you have some priorities that you see that money? Can you talk a little bit about those?
We know that the money's coming into the state of Oklahoma. The rules have not been written yet. The Treasury Department will be writing the rules. So we're still, monitoring what the guidelines are to release the money. The $1.2 billion that came in before, we set up a team and we brought in the legislature to give it, to make sure it got out to all the cities, the counties, like I talked about earlier, the small businesses, the schools, the COVID-related expenses across the state. This next COVID relief package, we don't know what the rules are yet on it. So we're gonna have to wait and see whether it's a revenue backfill, whether we can invest it in education, whether we can invest it in replenishing some savings. There's not the guidance yet around how that money can be spent.
Thanks, everybody.